Tuberculosis, which used to be called consumption, is caused by a bacterium called Mycobacterium tuberculosis. This bacteria usually attacks the lungs, but can affect any part of the body. Not everyone who is infected will become sick, and that's why there's two TB disease classifications. The first is latent TB infection, where a person doesn't have any symptoms and can't spread the disease. For most people exposed to TB bacteria, their body will learn to fight the bacteria, leaving it unable to grow. The second type is active TB disease. The symptoms of active TB can include a bad cough that lasts 3 weeks or longer, coughing up blood or sputum, pain in the chest, also weakness or fatigue, weight loss, loss of appetite, chills, fever, or night sweats. Tuberculosis is spread in the air from person to person. It is dispersed into the air in droplets by those infected through talking, coughing, or singing, and people with TB are most likely to spread it to people they spend time with every day. This includes family members, friends, and co-workers or schoolmates. Once exposed, some people can develop active TB disease within weeks, while some cases may take years. People at higher risk for developing TB disease include people who've been in close contact with someone with untreated TB bacteria, those who have immigrated from areas with high TB rates, those working at high-risk occupations including hospitals, homeless shelters, correctional facilities, or nursing homes. Also people with medical conditions that weaken the immune system such as HIV, substance abusers, or those with silicosis, diabetes, or severe kidney disease. There is currently no vaccine for TB in the United States. There are multiple treatment regimens recommended by the CDC for latent TB infection. Medical providers should prescribe the shorter and more convenient regimen if possible, so patients are more likely to complete the treatment. When prescribed medications for tuberculosis, it's very important that they're taken as prescribed. You can become sick again, or the bacteria can become resistant or grow stronger. And TB that is resistant to drugs is harder and more expensive to treat. Those taking medication should report any signs and symptoms of drug reactions to their doctor. If you think you've been exposed to someone with TB disease, you should contact your doctor or local health department about receiving a TB skin test or a TB blood test, and make sure to tell the doctor or nurse when you spent time with the person who is infected with TB disease. In the United States, we can test for TB exposure with a TB skin test, but this test cannot differentiate between latent or active TB infections. If a test is positive, then a more accurate blood test, chest x-rays, and sputum tests can help further diagnose active TB disease.